lot of people this year, 2020, having health on top of mind, maybe 2021 wanting to get in great health. But the fact of the matter is, a lot of people did not get their checkups this year, kind of avoided seeing the doctor, avoided leaving and going in any sort of health situation because of COVID. Well, our next guest says, enough putting that on the back burner. Take a look at your health now and catch things early before they become a bigger issue.
That's right. And you can do just that at Preventative Diagnostic Center. Dr. John Pierce is back on the show. He is the medical director at the center, and he joins us with all kinds of great information. But Sean said this is a great opportunity to get a scan of many different areas of the body and catch anything early if there is a problem. Let's talk about what the scan does.
Well, just like you said, it's all about being proactive, preventative. So the scan, we can scan anywhere from basically just below the chin, right on down through the pelvis. So if you start thinking of the organ systems there, you have your thyroid to begin with. We're able to look at the carotid arteries if there's any plaque buildup in there. Moving down to the lungs to see if there's any scarring, any infiltration from current disease like a pneumonia, even potentially COVID, God forbid.
Yeah.
Other aspects of the lung scarring. Things down to about the size of a grain of rice. So if there's any kind of growth in the lung, you get somebody who's been smoking their whole life, greater risk for lung cancer, greater risk for renal cancer. So the kidneys are at risk as well. So we're able to see any abnormalities in the kidneys, the liver, the spleen, throughout the bowels to include the stomach. We've caught some what are called hiatal hernias when the stomach kind of protrudes through the diaphragm. You get people that have a lot of reflux disease, right? And in women, we can look at the ovaries and the uterus. And in men, we can look right down through the prostate. So if there's any abnormalities, we'll be keyed on those. And then, a lot of times when we find those abnormalities, that's when the preventative medicine starts, because there's something going on. You probably need a little further testing, but at least we're able to get you on that road before something shows up. And usually by the time signs and symptoms show up, the disease has already progressed.
This is the remarkable thing about this technology, is the fact that, if you wanted to have something scanned, A, you're going to have to know whether or not there's something maybe going on there that they want to scan. B, it's only going to be in that little area. This hits absolutely everything at the same time. And it's not hitting you with a ton of radiation, just that small amount that you need.
Right. So the Somaton Go All Pro, made by Siemens. That's why I mixed the two together. But that really does just that. It measures the patient so we know how much radiation to give them. The machine calculates that so they get the lowest effective dose, and we get superior quality imaging.
Incredible.
Yeah. And in fact, I've been in and done the scan, doctor, and it's very non-invasive. It is not claustrophobic at all. It's really quite simple. I want to talk about fear, because I'm one of those people who I can pretty easily imagine in my head that I will get one of the biggies. And I'm talking about the cancer or a heart attack. And I think about this, and I know other people do too. So with heart disease, your scan can really detect several conditions that can give people peace of mind once they know, they're clear.
Absolutely. One of the things that we look at are the coronary arteries. And when if you smoke, you have high blood sugar, high blood pressure, this creates strain on the inside of the blood vessel called the endothelium, and it's unable to prevent things from getting on the other side of it. And that's the cholesterol issues. Yeah. And that's what causes the plaque. And over time, those things calcify. And that's what we're looking for, is the calcified plaques. And if there's a significant amount of those, we refer to cardiology, because they're going to want to do some further testing, i.e. a stress test, an echocardiogram. In some instances, we've had patients go directly to the cath lab. They had an angiocath done of their heart, and they found 80, 90% blockages. They were taken care of long before the person ever suffered any symptoms of a heart attack or any heart damage, more importantly.
That's the beauty. You catch it nice and early, which is a great thing. And that's the other thing is, once you do the scan, you're not just sending us a JPEG and sending us on our way. Like, here, there's your image. Goodbye. You look at it and you make sure, you know what? Okay, does everything look normal here? And if not, you'll point it out and then send them in the right direction.
Absolutely. We have a board certified radiologist who's been reading scans for probably 30 plus years. His eye is very, very keen. He sees something that is concerning to him. He relates it in the report. And then I get the honor of calling the patient. And I do think of it as that, because I get to call them and tell them what's going on, but in a way, excuse me, in a way that they're not going to be panicked. Because I never want to panic anyway. I just want to explain, here's what we found. It's very early in the course. Here's what we need to do moving forward. And that's why they got the test. They wanted to know if something was going on. If God forbid there is, we want to take those necessary precautions and move forward to basically cut it off at the pass.
We know early detection is key. So it's a super smart thing you're offering. You have a special offer for folks?
Yeah, we do. Actually, we're offering 2 heart scans for the price of, actually less than the price of one. We charge $5.99 for one. We're doing 2 heart scans for a couple for $125.
Wow. It's a huge
Awesome.
opportunity right now to get in and make sure that your health is in tip-top shape. It's great having you, my friend. Thank you so much for joining us.
Thank you for having us.
All right, take advantage of that special offer. Usually $5.99 for one, but now you and your best mate, your spouse or whoever it might be, can go in, get that heart scan with calcium score for just $125 total. That's pretty amazing. Their website right there on your screen. Preventative Diagnostic Center, a proud sponsor of the Morning Blend.